One of the most common questions we get in our office would be patients asking about, should we use ice or should I use heat when something hurts? And without actually looking at the patient, that can be a little bit difficult to answer, but the textbook version of that, which we usually would start with, is if it's an acute injury, so something that's really the first 24 to 48 hours after you know you've done something, ice is going to be a pretty good call, trying to decrease the inflammation by kind of shrinking the blood vessels and preventing extra blood from going to the area. That's going to decrease pain over the next few days and actually shorten healing time so that you get better in a few days as compared to a few weeks. If that problem's been there for, let's say, 2 to 3 days, anywhere up to 2 or 3 weeks, we may recommend kind of alternating that ice and heat, where we put the ice for 20 or 30 minutes, and then we do the heat pack, and then we go back and forth, kind of creating this blood flow where we're pushing blood in and pulling blood out, trying to help clean out that area and stimulate some healing and some new tissue. If it's been going on for a long time, typical muscle cramps or pains, usually we recommend heat for that. So chronic problems, a lot of osteoarthritis, these types of things really tend to respond better to heat, which helps to bring some blood flow, again, stimulating some healing in those areas. But to really find out what you should do in those injuries, if those things aren't helping or you're still not sure, you should see a specialist, see somebody who knows how to break that down, how to diagnose the problem, and we can make a much better recommendation that way.